When your doctor talks about your mesothelioma stage, they're using something called the TNM system. It's a standardized way of describing the extent of a cancer. You might hear terms like T3 on 1M ZRP or stage 3A, but what do these letters and names actually mean? Today, I want to break down the TNM staging system for mesothelioma in clear language, explain what each component measures, show you how T, N, and M combine to create overall stages, and help you understand what your specific T and M classification means for treatment and prognosis. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician and this is not medical advice, but understanding TNM staging helps you interpret your medical information and discuss options with your treatment team. So let's start with what TNM stands for. T is for tumor, specifically the size and extent of the primary tumor. How large is it? Has it invaded nearby structures? N is for nodes, meaning lymph nodes, whether cancer has spread to the lymph nodes, and if so, which ones and how many. M is for metastasis, which is distant spread. Has the cancer spread to organs or sites far from where it started? Each letter gets a number that describes the extent of involvement. Higher numbers mean more advanced disease. These are then combined to determine an overall stage that's between 1 and 4. The TNM system we use for pleural mesothelioma was developed by the International Mesothelioma Interest Group and adopted by the American Joint Committee on Cancer. It's specific to pleural mesothelioma. Peritoneal mesothelioma does not have a well-established TNM system, and it's staged differently. Let's break down the T categories for pleural mesothelioma. T1 means the tumor is limited to the pleura on one side. It might involve the parietal pleura lining the chest wall, the visceral pleura covering the lung, the mediastinal pleural, or the diaphragmatic pleura. But it hasn't invaded deeply into underlying structures. T1 is further divided into T1A, which is tumor on the parietal pleura only, and T1B, which is tumor on both the parietal and visceral pleura. T2 means the tumor has invaded at least one of the following: the diaphragm muscle or the lung tissue itself. This represents a deeper invasion than T1, but it's still relatively localized. Now, before I go on, I'm going to take a break and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe button below. It makes it easier for other people who need this information to find us. And if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section below. And make sure you watch until the end because I'm going to give you valuable information on where to find resources that will make a real difference for you. T3. That means tumor material has invaded into at least one of the following: the chest wall, including the ribs and intercostal muscles, the mediastinum, which is the area between the lungs that contains the heart and major vessels, the heart or pericardium around the heart or through the diaphragm into the peritoneum. This represents locally advanced disease with invasion into important structures. T4 means tumor material has extensively invaded into structures that make surgical removal impossible or very dangerous. This includes extension to the opposite side of the chest, direct invasion into major blood vessels, invasion into the esophagus, trachea, or other critical structures, or widespread chest wall invasion. Now let's look at the N category for lymph nodes. N0 means no lymph node involvement. All examined lymph nodes are negative for cancer. N1 means there's cancer in the lymph nodes on the same side as the primary tumor, and this represents a limited nodal spread. N2 means there's cancer in the lymph nodes in the mediastinum or around the heart on the same side of the tumor. This represents more extensive nodal disease. And 3 means there's cancer in the lymph nodes on the opposite side of the chest, in lymph nodes above the collarbone. This represents an advanced nodal spread. For the M categories, M is in Mary or for metastasis, it's simpler. M0 means there's no distant metastasis. The cancer hasn't spread to distant organs. And M1 means that distant metastasis is present. The cancer has spread to the liver, bones, brain, or other distant sites. How do these combine to create overall stages? Stage 1A is T1, N0, M0. It means there's very limited tumor on the parietal pleura only, no nodes and no metastasis. Stage 1B is T1B, N0, M0. That means tumor on both the parietal and visceral pleura with no nodes and no metastasis. Stage 2 is T2, N0, M0. That's tumor invading the diaphragm or lung with no nodes and no metastasis. Stage 3A includes T1 or T2 with N1. That's limited tumor with ipsilateral hilar nodes, or T3, N0. That's locally advanced tumor invading the chest wall, heart, or through the diaphragm, but no nodes. Stage 3B includes T1, T2, or T3 with N2. That's any of these tumors with mediastinal nodes, or T4, N0, or N1. That's very advanced local tumor with no nodes or ipsilateral nodes. Stage 4 includes any T with N3. Tumor material has spread to contralateral or supraclavicular nodes, regardless of tumor extent, or any T with any N and with M1. That's any tumor and node status with different metastasis. Why does TNM staging matter? It provides standardized language so doctors everywhere classify diseases the same way. It predicts prognosis. Higher stages have worse outcomes than lower stages. It guides treatment. Patients in early stages might be surgical candidates, while those diagnosed as being in advanced stages aren't. It determines clinical trial eligibility. Trials often have specific stage requirements. It also allows a comparison of outcomes between different cancer centers and their treatments. What's the relationship between TNM and survival? For pleural mesothelioma, stage 1 has a median survival of about 20 to 22 months with treatment, and stage 2 has a median survival of about 18 to 20 months. Stage 3 has a median survival of about 14 to 16 months, and stage 4 has a median survival of 12 months or less. These are medians. Half of patients do better and half do worse. Cell type, treatment received, and individual factors all matter enormously. Can your TNM classification change over time? Yes, in several ways. As we discussed in another video, clinical TNM based on imaging often differs from pathological TNM based on surgery. If the disease progresses or recurs after treatment, you'd be restaged with new TNM classifications. If you have additional surgery, new pathologic staging would be performed. What should you ask your doctor about TNM staging? What's my specific TNM classification? What does each component mean in terms of where the disease is located? And how was this determined? Clinical staging from imaging or pathologic staging from surgery? What overall stage does my TNM translate to? How does my stage affect treatment recommendations? And could the stage change with more information or surgery? Understanding TNM helps you interpret prognostic information you might find online or in research studies. When you read that a study enrolled stage 3 patients or that 5-year survival for stage 1 is X%, you'll know how to relate that to your own TNM classification. For peritoneal mesothelioma, TNM staging is not well established. Many centers use the Peritoneal Cancer Index, or PCI, instead, which I'll cover in another video. This assesses tumor burden across different abdominal regions. To review The TNM staging system for pleural mesothelioma uses T, tumor extent, from T1 to T4, N, which is lymph node involvement from N0 to N3, and M, which is metastasis using M0 or M1 to create overall stages 1 to 4. It describes the invasion depth from limited pleural disease to extensive local invasion, describes nodal spread from none to contralateral or supraclavicular nodes, and describes distant metastasis, whether it's there or not. Higher TNM values and stages correlate with a worse prognosis. Understanding your TNM helps you interpret the treatment options and prognosis information that you're given. You can visit mesothelioma.net for detailed information about mesothelioma staging, or call 1-800-692-8608 or use the live chat features on our website to work directly with one of our patient advocates. As for me, remember to post your questions below, and I'll see you next time.